If we provide information to Canadians, they can make good choices.
A new RSV in-person rapid testing service is now being offered in Winnipeg to combat rising wait times in hospitals. The recent surge in RSV cases in children across Canada has been overwhelming emergency rooms. RSV is a common respiratory virus that causes infections of the lungs and respiratory tract. Testing for RSV is done in hospitals, but due to the high demand, ERs will not be testing unless patients are admitted to hospital with a serious case.
Right now, people can't get it. They don't have a doctor. They can't go to the ER or choose not to go to the ER and wait. Obviously, the ERs can't support everybody with everything.
Now, a new in-person RSV rapid testing service is being offered with the option to have same-day virtual appointments with a licensed physician in Winnipeg beginning on Monday.
We've been able to identify a testing technology that has been in existence for a long time. It's very accurate, just not available to people.
Former ER doctor Samuel Gutman, the president and chief medical officer of RockDoc, says financial assistance will be provided to those who cannot afford the $60 fee for the tests. Gutman says the process is simple.
People can come in, they can book online. They're in and out in 10 minutes, so they're not sitting in a crowded waiting room exposing each other to additional disease. They come in, they get the test, they go home, they get the result, and they get some advice. And then it's up to them to make the decision. Do they want to access a telehealth physician? Do they want to go to the ER?
A spokesperson for Winnipeg's Health Sciences Centre Children's Hospital says the pediatric intensive care unit at the hospitals continues to see high patient numbers that are being largely driven by a number of respiratory illnesses. An average of 130 patients per day visited the Children's Emergency Department in December, down from the record pace of November when 170 patients visited per day. In the first week of January, an average of 133 patients per day have visited the Children's ED. Dr. Gutman says it's unknown at this time if RSV cases will worsen in the next few months.
My personal guesstimate is that this will continue on for a few months, and then will, as it usually does, will reduce over the spring and summer, and hopefully in the subsequent years we'll be better ready to deal with it from an immunological perspective.
In Winnipeg, Alex Karpa, City News.